Institute's Impact Speaker Series. My name is Dr. Gigi. I'm the founding director, and our institute is housed within George Washington University School of Medicine and Health Sciences. I'm very excited about this evening's webinar and discussion, really, because it is really about staying safe this summer. And I think we're also fixated on COVID that we forget some of the other things. And so it's not either or, it's and. And we've got an incredible group of panelists this afternoon or this evening. Before I introduce them, let me just sort of give you a quick update about COVID and COVID vaccinations. COVID has actually made a downturn in terms of number of cases and number of deaths in our area. However, there are huge disparities. Unfortunately, the numbers are still high in wards 7 and 8, and it's estimated that 83% of the new cases are actually among African Americans. We know that the vaccines work. We know that having the vaccines as available and close by so people don't have to, take 3 bus rides to get to vaccines is really best. We have our various partners, including Pennsylvania Avenue Baptist Church in Ward 7, Temple of Praise in Ward 8 that gives vaccines all the time. We're actually going to be on Friday, we're going to be at Pennsylvania Avenue Baptist Church for the Juneteenth celebration. So I hope that people can come by and say hi. I don't want to forget, because I tend to forget, to thank Ms. Ashanti Carter. She is the program manager of the Ryden Institute, and she is wonderful and doing a great job. She's the one that really gets these webinar series and guests arranged and all these topics. I'd first like to bring on our Ryden Institute intern, Ms. Kayla McKenna, who I'm so proud of her because she's going to go to UCLA in the fall. And she is going to be the co-moderator. She speaks fluent Spanish. This is going to be our second webinar, which is going to be translated because we want to make sure that as many people are included as possible. Sometime we'll try to have another deaf interpreter also join us. We've had that before and it was quite successful. All right, well, without further ado, let me go ahead and introduce our panelists. And what I'll do is I'll introduce them and then I'll say their name and then they'll just say sort of what their title is and a little bit about themselves. So we're going to start off with Dr. Oruh. Dr. Oruh, welcome.
Hi, good evening. Thanks for having me. I'm Chioma Oruh. I always say I'm a mother first because that's what I am, a mother of 2 brilliant autistic sons. They are ages 10 and 8 years old. I'm also a consultant with Chimo Uru, which is I'm a founder of that, and I consult with the GW Center for Health and Healthcare in Schools.
Wow, can you tell us a little bit about your foundation, your not-for-profit?
Oh, my organization. Well, I just started. Well, so Chimo Uru is a consulting company that I started just last year, transitioned out of being, a family support worker, working for our Parent Training Information Center. And it's really a space for me to articulate supporting families just like me that are navigating the systems of care, both health care wise and education. So primarily supporting families, neurodiverse families and economically disadvantaged families that have children with special needs and mental health conditions navigating the DC public education system, branching out into Maryland and Virginia and hoping to support families there as well.
Wow, well, welcome, thank you. You used a term I've never heard before, neurodiverse, is that the term that you used? Okay.
Yes. Yeah. So neurodiverse just the variation of how we show up in the world. Neurodivergent is if you show up non-typical or so-called typical, and just promoting diversity on another level.
Great. And I have a question for you because this has been coming up on the news. I've heard some controversy about using the term special needs versus disabled. What do you prefer? I know it's not everybody prefers the same sort of terminology, but can you tell us what your preference is?
Sure. As as somebody who considers myself now part of the disability scholarship, disability studies scholarship, I taught a course at Howard University last semester on decolonizing disabilities. And there's, you know, the history and the genealogy of the word disability was identified by people with disabilities who were fighting for their rights. So I proudly, you know, identify as a disability family, but I understand people wanting different variations. My kids, again, are autistic. The autistic community prefers autistic first. I know some other disability communities prefer person first. So you're a person with versus the disability and in your name. So there's so much variation, and I think it varies per disability category. I do think that whatever the rationalization you use in special needs, hopefully it is not an ableist understanding, because there's some kind of, you know, not willingness to accept disability as a status in society that deserves equal representation in all places.
Well, thank you for that. And I realized that I didn't ask Kayla to translate. So that was a lot, Kayla. Can you just summarize, please? I'm so sorry.
Okay, well, primero, Dr. Chioma está una madre de dos niños autistas y trabaja en un sector de ayuda a las familias que tienen niños neurodiversos y navegando el sector de educación y todas esas cosas. That was a lot. So.
Muchísimas gracias, perdóname. I'm sorry about that. I will do better. I'm so sorry. Okay. Thank you for being so gracious. And you know, when and I'll have you translate this, Kayla. One of my things that really irritates me about physicians or people in the healthcare system is when they say the diabetic, the hypertensive. I mean, you say, you know, Ms. Jones who has diabetes. So to your point, I think that that's important. Please, Kayla, go ahead.
Dr. Gigi prefiere que no se dice que alguien está autista o está diabética, pero que dice que tiene diabetes o autismo, porque es más respeto para el persona.
Gracias. And next we have Dr. Lauer. Welcome. Please introduce yourself.
Thank you for having me. I'm so excited to be here. I am a child and adolescent psychologist. By training, I specialize in integrated primary care, which is a little bit different than what we classically think where psychologists are housed, which is specialty care. You need a referral, you go to a special clinic.
I'm going to stop you because I'm going to have Kayla translate. I'm sorry. So we don't get into the same thing. Go ahead, Kayla.
Kayla, if you'd like, I can say both. I'll do it in English first and then in Spanish.
Oh, terrific.
Yeah. And so part of that integration is to see kiddos, you know, at their pediatrician's office when something is first getting identified and helping to do some triage and recommendations early on. So we are not getting to things being worse down the line. Buen día, soy una psicóloga clínica. Estoy integrada en una clínica de cuidado primario para niños y adolescentes. Mi entrenamiento específico es de niños y adolescentes y consulto a los pediatras cuando hay alguna preocupación acerca de cómo la persona joven se está desarrollando y cómo están yendo las cosas. En esa situación puedo dar consejos o referidos a tratamientos.
Gracias. Dr. Bryant, welcome.
Thank you. But I do want to say I'm not a doctor, just
okay.
I am the Associate Director of People Operations for DC Prep. It is a charter school, 18. We've been here around for 18 years. We serve wards 5, 7, and 8.
Okay, I'm going to stop you so that Kayla can translate, please. Oh, you're muted.
Señora Bryant es el director de operaciones en una escuela autónoma de número 18 y sirven a las wards 5, 7 y 8.
We have 6 schools, and we serve pre-K through 8th grade. And I just want to say that I am super excited to be here and hear all the wonderful things that the Ryden Institute is sharing with us, and just grateful for the opportunity.
Thank you. Kayla?
Tienen 6 escuelas que sirven los grados de pre-K hasta los 8 grados.
Great. And I understand, Dr. Anderson, that you speak Spanish as well. Is that right?
Yes, that's true.
Well, welcome. Please tell us about yourself.
Thank you. I'm Dr. Andrea Anderson. I'm a family doctor, and I've been a family doctor for almost 20 years now. And I am part of the DC Scientific Advisory Committee for COVID-19 vaccine distribution. Hola a todos, me llamo doctora Anderson y soy una doctora familiar. Ha sido una doctora familiar hace casi 20 años ahorita, y por muchos años yo trabajé a la clínica Upper Cardozo en la Northwest DC para la Unity Healthcare. Y ahorita trabajo al George Washington y estoy en parte del comité que están directando la distribución de la vacuna contra la COVID-19. So, gracias para tenerme.
Well, thank you. Dr. Anderson, let's start off with you because I think parents, families, of course, are most concerned with COVID. Kayla?
Vamos a empezar con doctora Anderson porque las familias son muy nerviosas sobre la COVID.
And now vaccinations are available for children 12 and over.
Y ahora las vacunas están avalables para los niños que son mayores de 12.
But there is the Delta variant, which is scary because it is more deadly and more infectious.
Hay una otra versión que se llama Delta y es más peligrosa.
So what would you tell families who have children or young people themselves about getting vaccinated?
¿Qué dirías a las familias con niños muy pequeños sobre getting la vacuna?
Yes, so I would say to all the families listening that the best thing you can do for your family is to get them vaccinated. Every person above 12 years old in your family should be vaccinated for COVID-19. Mi consejo a todas las personas que están aquí en este webinar es que necesita obtener su vacuna de COVID-19. Si tiene algunas personas en tu familia que tienen más de 12 años, están elegibles para la vacuna, y es muy, muy, muy importante. Necesita su vacuna. Right now, all of the vaccine sites in DC are walk-in. You can go there with no appointment and receive the vaccine. It is free, and you just need to be a resident of DC. You don't need to be a citizen. You don't need to have your papers or any, specific documentation. You just need to be a resident. Ahorita todos de los centros de la vacuna aquí en DC son gratis, no necesita una cita, no necesita papeles específicos, solo necesita ser una residente de la ciudad de Washington, D.C. y puede recibir su vacuna. So, ese es mi consejo a todos que están escuchando.
I'm going to turn things over now to Kayla, who's got the questions. So my co-moderator, I toss it to you.
Muchas gracias. También para doctora Anderson, ¿qué tendencias has notado en la propagación de COVID? What trends have you seen in the spread of COVID?
So we are doing much better in our fight against COVID-19. This is good. We see much less cases than we did at our last peak, which was in the winter. There are less people who are hospitalized, less people who are very sick from COVID. So ahorita estamos mejor con el COVID, ¿sí? Hay menos casos de COVID, menos personas que están sufriendo de COVID desde el último tiempo que fue lo más alta, que fue en el invierno. So ahorita es mejor, pero no está terminado. It's not done. We are still in a pandemic. Todavía estamos en un pandémico. We still have a risk of COVID-19. Todavía hay riesgo de COVID-19. Es porque we need to be vaccinated. Es porque necesitamos la vacuna for COVID-19. So if you look at the entire country, about 500 to 600 people a day are dying from COVID.
Mm.
Those numbers are much less than before, but it's still 500 to 600 people. That's still a lot of people. Todavía, si pensamos sobre todo de los Estados Unidos, hay como 500 personas que están muriendo cada día de COVID-19. Estos números son mucho bajos que de antes, definitivamente, pero todavía es 500 personas, muchas personas. No es cero, no es 1 o 2 o 3 personas. Todavía estamos en este pandémico. We're still in this pandemic and we still need to get our vaccine. Todavía estamos en este pandémico y necesitamos nuestra vacuna porque este es la única manera que podemos pelear totalmente sobre el COVID-19 y totalmente podemos terminar este pandémico. That's the only way we can really fight against COVID-19 and really end this pandemic.
Okay, can I also ask you, what trends have you seen in, not just the spread, but in vaccine hesitancy? La hesistancia de obteniendo la vacuna.
Great. So the numbers here in DC are good, but they could be better. As of today, about 48% of DC residents are fully vaccinated. 48%, okay? So los números aquí en DC son buenos, pero podemos tener más personas que tienen la vacuna. Por ejemplo, solo hay 47% de los residentes de DC está vacunado totalmente. Okay, so only about half. And that shows that we still have a ways to go. Many people feel, they're in a crowd, they're at the beach, or they're somewhere. If you look at that room of, say, 100 people, just think to yourself, 50 of them are fully vaccinated. 50 of them are not, right? So you still have a risk of, being around someone who's not fully vaccinated. So, por ejemplo, si está en un cuarto de 100 personas, necesita pensar, ok, 50 de estas personas están vacunados, pero hay 50 que no está vacunado. Y todavía hay un riesgo que una persona puede tener la infección de COVID-19 y no sabe y puede pasear a otras personas. So, eso es porque es muy importante. Muchas personas me dijo que, pero usa mi máscara, pero yo lavo mis manos y tengo mucho cuidado. Bueno, qué bueno. Y necesita su vacuna. Many people say to me, but I wash my hands, I wear my mask, I'm so careful. And I say, great, keep doing those things and go get your vaccine. Because really getting the vaccine is the strongest way to fight against COVID. One way to think about it is, and I'll stop after this, using a seatbelt when you drive in the car, right? Even if you're a very careful driver, you say, I always follow traffic lights, I'm so careful when I drive, you can still get in an accident, right? Someone could still come hit your car. Someone could still, something could happen that you didn't plan for, right? So you always put your seatbelt on when you get in the car, right? And you always strap your kids into their car seat. You would never say, oh, I'm so careful, I'm not going to strap my baby in because, I'm really careful, right? You can't control everything that's going to come to that might hurt your children. So that's why it's very important to get your vaccine. I don't know if I can translate this one. Una manera que pensar de este es cuando está manejando un carro, ¿sí? Todo el tiempo va a poner su cinturón. Va a poner su cinturón, aunque si está manejando con mucho cuidado, está una driver que mucho cuidado, todavía va a poner su cinturón porque no puede controlar todo. Y va a poner la cinturón de sus niños especialmente porque quiere que ellos estén lo más seguros que posible. So, es porque necesita poner necesita tener su vacuna para la protección de usted y de su familia.
That's very important. Can you also tell us what exactly is a vaccine and how does it work?
You just muted. You just muted.
¿Qué es una vacuna y cómo se funciona?
Okay. So a vaccine is something that we can use to protect ourselves against a disease. The vaccine teaches our cells how to fight against the disease. It shows our cells who the bad guy is, i.e. the infection. It's like showing ourselves a picture so that we're like, okay, look for this person. This is the bad guy. This is COVID-19. If he comes in, get him. That's the one right there. So that your body is prepared. So if COVID-19 shows up, you're not surprised. You're not like, oh, who are you? I've never met you before. Come on in. What did you say your name was? Your body's not going to say that. Your body's going to know, hey, this is the bad guy, and you're immediately going to fight against it. So the COVID-19 vaccine teaches your body in advance how to fight against this infection of COVID-19. La vacuna de COVID-19 es una manera que enseñar su cuerpo cómo pelear contra la infección de COVID-19. Entonces, si tiene un COVID-19 o tiene la infección de COVID-19, su cuerpo sabe inmediatamente, no es correcto, este es COVID-19, yo necesito pelear contra de este. Su cuerpo puede preparar como está en una guerra, puede preparar para saber quién es el enemigo. Oh, ahí está, COVID-19, y está preparado que pelear contra la COVID-19 antes de la sufriendo, antes de la enfermedad de COVID-19 puede ser más peor en su cuerpo. So, eso es cómo funciona la vacuna.
Okay, very good. For Dr. Lauer, can you walk us through the mental health and mental illness PowerPoint now? Are you ready to do that? Por Dr. Lauer, por favor, puedes muéstranos la presentación de salud mental y enfermedad mental?
I am happy to do that. Just as a heads up, it's written entirely in Spanish. So I think what I'm going to try to do to be efficient with our time is speak in English, but the content will be the same and it's written in Spanish. So hopefully that covers our bases. All right. Can you see it?
Yeah.
Wonderful. So this is just the introduction. We've already gone over this. This is just a little orientation to what mental health is. I think we often talk about mental health and mental illness, and it's unclear what we might be referring to. When we think about mental health, someone like myself, a psychologist, may be thinking about how each of us manages and deals with our thoughts, our emotions, and our behaviors. It's on a continuum, right? There isn't a necessarily marked difference. Here's mental health, here's mental illness, because it really depends on is the way that we're managing our thinking and our behaviors and our emotions preventing us from engaging in our daily lives in the way that we are expected to engage in our daily lives. So really, we want to be thinking about, are you functioning, coping, meeting your daily demands in the same way that you always did? And if that has changed, that is a wonderful time to be thinking more carefully about what is going on. Areas that might that you might notice that your functioning is changing might include your relationships with friends and family and your children, how you perform at work, how you perform at school, how easy or hard it is to learn or to retain new information or to acquire new skills, and when you withdraw from those activities in your daily life that you used to do and enjoy, say an exercise class. I'll jump into this. I only have about 4 or 5 slides, so maybe I'll go through them, and then if there's specific questions, we certainly could loop back. But these are just some red flags that might be important to be paying attention to. And I really focused on our young people because that's who I work with the most. So for young ones, you're looking at chronic irritability, excessive tantrums that are very, very difficult to control, chronic complaints of stomach aches, headaches that don't seem to have an organic or a medical reason, difficulty sitting still when sitting still is required, like for a class, lack of interest in things that are expected for the age range, making friends, playing during the playground, or fear, having to check themselves multiple times, needing verbal reassurance that the things that they're doing are correct. For adolescents, you're looking more at isolation, lack of interest in hobbies that they used to have, big changes in sleep, sleeping too much or sleeping too little, both could be concerning. Excessive behavior, so excessive exercising, excessive dieting could also be of concern. Of course, any self-harm or any time that a young person is speaking to you about thinking about not wanting to be alive anymore, those are absolute red flags that we want to be taking really seriously and paying really close attention to. A little bit about the school year. It might be a challenge to return in the fall in person just because things have changed so much. Parents can start preparing in the summer, though. Some key areas to be thinking about is, as much as possible and as is safe, return to normal activity. Think about routines. I live and die by routines. Our kids love routines. So think about how much you can return to routines that were normal before for you. Talk and talk and talk about what to expect. Answer your kids' questions. Let them know that there's things in place for them to be safe at school, so that it might look a little bit different, and make sure that their questions about what will be different are answered, and practice that. Practice thinking about what the day is going to look like. Practice thinking about who's going to pick them up. And I think it's reasonable for us to all be prepared for some challenges in the beginning. It's going to be a transition, and it's okay if it's a little bit hard and we can't just jump right in. Just like in the beginning when we went on the pandemic, everything felt so odd and we had to adjust to new systems and new procedures. It's kind of the same going back into a new normal. I don't know if there's teachers here. I just put a few tidbits of ideas and I would be happy to chat more about that. But also, expect a little bit of difficulty. I think considering trauma, you're likely to have students who have lost loved ones or who have seen their parents lose their jobs, and they may have been impacted by this traumatic exposure. Check-ins are lovely to normalize that talking about our feelings is okay, even at school. And check-ins can be a really wonderful time to identify strengths. Holy moly, do our young people have strengths? And how do we identify them, and how do we use them in challenging situations? And finally, teachers are so knowledgeable about their kids and they see them every day. When you notice something's really different, it's okay to be concerned and either consult with your school counselor or just refer the child for some additional consultation. So that covered a few broad areas. Hopefully folks were able to read the screen that was in Spanish if that's their preferred language.
Awesome. Thank you so much for that. Muchas gracias. También para doctora Laura y doctor Chioma, ¿qué son las tendencias que ha visto en retos de la salud mental? ¿Cómo pertenecen a las jóvenes y cuáles son las implicaciones para ellos cuando regresan a la escuela? I know you just kind of covered that, but if Dr. Chioma has anything else to add as well, that would be really appreciated.
Can you please
What
repeat
was
the
the
question in English?
What was the question?
Friends have you seen in mental health challenges? I'm sorry, I forgot. What challenges have you seen with youth and mental health issues, and what are the implications for them as they return to school?
Yeah, so I'm working with families as a whole team, as a whole unit. It's really compelling. I hear the narratives primarily from their caretakers, from their primary caretakers, and I'm seeing just a spectrum of things that it can start even with my own narrative. I lost my dad, unfortunately, to COVID last year. He died on May 9th, 2020, and that is a loss for the whole family. So it's as my kids have re-entered school, really notify the entire team that this is a situation, and taking those steps. So I encourage other families that I know that have gone through not just the loss from COVID, but this, we've had two pandemics, right? We've had the pandemic of COVID-19, but we've also had the pandemic of racial injustice and just social inequities. We've seen exacerbated things like not having access to technology, not having access to food, not having access to the basic needs and essential needs. And your status matters in answering how you navigate the systems and answer those questions. I'm going to pause and let you translate before continuing.
Doctor Oruh dice que perdí su padre el año pasado y es muy difícil para su familia y también para sus hijos, y es importante para las familias que toman el tiempo para pensar de todas las cosas que han pasado en el año pasado, no solo el COVID, pero también perdiendo las miembros de la familia y también los eventos de injusticia racial. Y es importante que tener esas conversaciones y navegar esas cosas en la casa y también en la escuela.
Yeah, and so I think in addition to these dual pandemics, that we have to handle our kids with care. That's those who had pre-existing conditions, whether families like mine that have students with disabilities, may have an IEP, may have a 504 in place, and the emerging traumas that students are going to be coming back into the school building with and in the school community with at any stage, whether they are, able to adjust, that still requires care, because if they're able to adjust and their classmates aren't, what's their level of understanding? And for those who are not able to adjust, how can we promote, again, the neurodiversity that I mentioned before, the accepting students as they are, not punishing them per se, but finding the supports and services. So part of what I do with the GW Center for Health and Healthcare in Schools is promote the school behavioral health system, the expanding of that system, to ensure that students at any tier of support, whether at the school level tier where everyone receives what they need and we're able to identify in safer spaces, or the small groups or the one-to-one supports, we're hoping that the reintegration back into the buildings and into school communities looks as safe as we have been planning it to look throughout this pandemic. And no one has taken a break in the school behavioral health expansion. So we're very proud of the systems that we're setting up in the District of Columbia to support our students and their families.
Okay, es muy importante que nos apoyan todos los niños, también los que tienen condiciones mentales, y que estamos seguros en ellos habilidad para regresar a la escuela, y si no están haciendo bien inmediatamente, cómo podemos ayudarnos y están seguros que ellos van a ser bien en la escuela después de tanto trauma, Mm-hmm.
I'd like to bring in Ms. Bryant, because you are in DC public schools, and obviously DC schools have, as Dr. Oruh mentioned, have not taken a break and kids' needs have, if anything, increased. Kayla, can you translate, please?
Han creado las necesidades de los niños antes de después de COVID en las escuelas. Have the needs of, well, she said it in English, have they increased?
I think they have increased, and I think more importantly, they've changed. I think everyone's sense of normalcy has changed over the year in general, but we have done our best to adapt to our students' needs. We want our preppies to be successful, and we've come up with a lot of new and creative ways to reach them. I think my favorite part is how the students are finding new ways to feel included and successful and feeling like they're moving forward. Our teachers have done a really great job at keeping students engaged and feeling encouraged through it's been a really challenging year. So I think it's just about the changes and how they've developed and kind of, I guess, morphed into something else and caused us to put our thinking caps on and come up with new ways to reach them.
Dijo que ha cambiado no solo en el año pasado, pero en muchos años pasados, pero estamos haciendo el trabajo mejor para ser creativos y hace más formas de ayudar a los estudiantes y somos muy resilientes y estamos moviendo a más mejores métodos de hacer esto.
And can I ask also, because I think this has been a tough time, of course, for students, of course, for families, but what about teachers? Because, you know, that first of all, teachers should get they should be paid their weight in gold, as should nurses, as should all the frontline people, not just, you know, healthcare workers, but really all the bus drivers, the custodial staff, everybody, but teachers in particular, you have just a lot that you're dealing with, including your own stuff. I mean, what can we as communities or family members of children that you're taking care of, what can we do to maximize how our children do, but also to support you? I know that's a lot, Kayla, but I'm gonna have you try.
Dr. Gigi sabe que también los profesores tienen que están sufriendo mientras de todo que está pasando ahora y ella quiere saber cómo podemos apoyar a los profesores si podemos hacer más bueno por los niños en esa forma.
Yeah, it's definitely been a challenging year for teachers. It's, you know, put a brand new spin on balancing home and family life for a lot of them. I think the best way we could support teachers is just to remember that we're all kind of in the same situation right now. You know, I know that there are some people that have children right now balancing their own careers, and keep in mind that teachers are doing the same. You know, they experience, you know, deaths in families, their own mental health that they're trying to balance. And on top of the challenging work we do with trying to reach students, it's also, you know, finding new ways to balance your own mental health, finding time for yourself. And that was particularly difficult, of course, during quarantine when you were supposed to be in your house the whole time. So I think the biggest thing is just remembering that teachers are also balancing a lot of things and pushing in when you can to help. Right now, I think it was just about just all of us kind of banding together, leaning on each other and supporting the community and the people around you when you can. I think that a lot of teachers really appreciated parents that reached out to thank them at the end of the year. It was things, just notes, cards that just let them know that they heard them, they saw them, and saw the progress and the reach and span they were getting to their children. It's really encouraging and helpful to hear that teachers know that you saw them and understood the work and the effort they were putting in to help keep our children moving forward in a really difficult time space.
Es importante que recordamos que los profesores son humanos y también ha sufrido mientras de todo lo que está pasando, y es importante que nos ofremos nuestra apoyado y también nuestras gracias, porque están trabajando muy duro, y es importante que muestramos que necesitamos los profesores, ellos son muy importantes.
Mhm. I mean, I think that the whole experience of online learning for people that had access to computers, right? Because there is the digital divide, gave parents a firsthand look, and grandparents and whatever adults are in the family, a firsthand look at just how challenging it is to be a teacher and to have kids, you know, this whole time. I think that probably a lot of people can't wait for their kids to go back to school.
Yeah.
Kayla.
Dr. Gigi cree que muchas personas están divertidas para sus hijos regresando a la escuela, porque es muy difícil si tiene toda tus familia en la casa todo el tiempo, y es importante que nos recordamos eso y damos nuestras gracias.
You know, one point that we learned when we did our mental health summit, Dr. Olga Price mentioned that one of her children, I believe, is challenged with autism, and he actually did really well and got straight A's during the online learning. So we always make the assumption that online learning is a bad thing and has negative, but that's not necessarily true. So can I just ask, I'll have Kayla translate first, but what, you know, how is that going to be for kids that actually kind of did well? How are you going to do that hybrid? Or are you?
Oh, sorry. Dr. Gigi está curiosa sobre los niños que le gusta esa nueva forma de aprendizaje, porque estaba hablando con su amiga doctora Olga Price, y ella tiene hijos que tienen un hijo que tiene autismo, y él está haciendo muy bien con aprendizaje virtual, y ella quiere saber qué vamos a hacer con los niños que le gustan aprender de casa. That's for all of our panelists. Anybody can jump in if they want to talk about that.
I don't want to dominate the conversation, but I think, well, I mean, at our organization at the moment, we are offering a hybrid model because while there are some parents that are waiting for a little relief from having kids balancing homeschooling and working, there are some parents that still don't feel comfortable with having their kids inside the building, or you know, or maybe not there yet, or waiting on a vaccine, or whatever the case may be. So we're offering a hybrid kind of model, but I guess in long term, we're finding that some kids are more successful than others at virtual learning. I think, I mean, we haven't necessarily started the work yet, but I think it's just about adapting and finding what made the child feel successful in the first place.
Mm-hmm.
You know, virtual learning, other than the fact that the interface, how you type in your answers or something like that, it shouldn't, you know, doesn't necessarily differ differently or anything else in terms of like being in person. So I think it would be about pinpointing, you know, how the child felt successful, what about the aspect of that learning that made them successful, and just kind of going from there. But I think there's always, as we've seen through the year, there's always a way to adapt and change and meet the child where they are to make sure their needs are met. And I think that our teachers will do the same with students that may have done better with virtual learning as opposed to in-person learning.
With the caveat that kids from Ward 7 and 8 may not have the digital access. And I think as we look at these educational issues or healthcare issues, and that as we become more sort of dependent on this type of communication, it behooves us to really advocate for citywide free internet and also supplying computers. I mean, because that is just actually widening the gap between the haves and have-nots. So I know that that's part of the infrastructure plan that the Biden-Harris administration is trying to get passed. So this broadband and so forth, but we can advocate. There are cities such as Seattle, for example, which have free Wi-Fi. So anyway, sorry, Kayla, I know that's a lot to translate.
I actually, unfortunately, I have to jump in because there's one thing that I would like to get to, and it looks like we're coming up on the end so soon. The time flies, but for Dr. Chioma or Dr. Oruh, can you tell us about what happened to your son and how that changed the school policies around mask wearing? Por Dr. Oruh, por favor, díganos por qué lo pasó a su hijo y cómo eso ha cambiado los requisitos de las mascarillas en su escuela.
Yeah, it's a really, I don't know if we've changed any policies just yet, but I do believe that everything happens for a reason, and that it happened to my family for the purpose of needing to, really give light to darker spaces that students and vulnerable students navigate. So my then 7-year-old who turned 8, his name is Jadafar, we call him Jedi. And just, Jedi is also an acronym. Interestingly, we know what Jedi is, the Jedi Knights, but Jedi also is for justice, equity, diversity, and inclusion. I didn't name my son. I wasn't that foresighted to think of that way, but I think it's apropos considering, where we find ourselves. So Jedi and his older brother Ati, they both attend non-public schools, which means that these are private schools that are publicly paid for because we petitioned for it as part of our special education rights. And so Jedi, on a hybrid schedule, we had IEP meetings, we prepped the team. And, everybody on his team knew that Jedi does not like to wear masks for sensory reasons. And so we got doctor's notes from our wonderful advocate pediatrician at Children's National, Dr. Danielle Felton. And he supported in, listening to the issue. And we actually had a physical visit before he wrote the note to really engage with Jedi. And so, we thought we were straight. But Jedi gets on the school bus. And unfortunately, this is about week 2 or 3 back on a hybrid schedule. And so we weren't having the same bus driver every time. And so the bus driver and the attendant this time, they pull off because I will put the mask on Jedi and Jedi will get on the bus. And then when he gets on the bus, he takes off the mask because it's not something that he has learned, to do or overcome his sensory challenges to do so. They stopped the bus and said, "Get your kid off the bus." And I said no, because I know his rights, I know our rights. And I said, we have a doctor's note. And they called the dispatch. She said there's no record of it. Long and short, in the refusal of Jedi, for Jedi to get off the bus, or me saying Jedi should not get off the bus, and Jedi stayed on the bus, and we had this ongoing back and forth of them trying to identify his records, and me even showing them on my phone. Somehow that didn't factor in, and they didn't humanize even me as the mother, much less Jedi as the child. And this is, again, I want to frame it knowing that everyone is human and acting out of human behavior and apprehensions in this moment. But they called the police without any conversation about taking that step. And, I feel grateful that I had the wherewithal to record that moment, because again, I'm at distance saying that I should not be on the bus. So I'm seeing the cops approach, and, luckily we got officer friendly that day. There were 2 Black women officers, and it didn't end in a fatal kind of situation. And it was a possibility. That's the invitation in that moment. So we were terrified, and I did what I do, which is advocate. I advocated for my family as hard as I would advocate for anyone else's. And this is not an isolated incident that students with disabilities get secluded, restrained, suspended, and expelled at higher rates. And I witnessed it. And, I witnessed Jedi not being humanized in that moment. Hopefully what we can do moving forward is find those human moments. Really, the steps I've taken personally is to really try to get to know the bus drivers that pick up my children, ask for them to have consistent people so we can all develop positive relationships versus the swapping out and never having that level of relating to make it safe for all of the kids. And so we are still working through it on many levels. And I just know that this happened to my family, but it can very well happen to anyone's family. So we deal with it personally and we deal with it systemically as well.
How's Jedi doing now?
Jedi's okay. Jedi's okay. The great thing about Jedi being so, self-involved and self-insulated is that, he constantly protects his inner landscape, and it is challenging. The challenge of he's not nonverbal, but he is emerging in speech, and so he's not able to vocalize every single emotion and every single incident that occurs to him. So part of being in autistic and having autism is that it's hard to really know how trauma impacts him, and it's my duty to just pay attention when behaviors change. And I have seen small things, and I'm in communication with his teachers and his team. We have IEP meeting coming up before they go full time. So I'm grateful just for the ability and the community that immediately saw it go viral and helped it go viral locally. And from our council members to our advocacy community to just the people that I work with that know and love me and my family, I feel very fortunate, and that's why it's a duty to make sure that the systemic level of this is also addressed.
Hmm.
Cuando Dr. Oruh y su hijo fue en un autobús, el manejador llama a la policía porque su hijo no quería llevar una mascarilla, y él tiene autismo y no es natural para llevar uno de esos, y él tiene problemas con las sensibilidades en su cara, y el manejador llamé a la policía, y en un hijo que solo tenía 7 años, y eso es un problema muy, muy grande de racismo y también de tolerancia de las personas con enfermedades mentales, y eso es un problema muy grande.
Yeah. I'd like to ask Dr. Anderson a question, if I might, because it is summertime, and we are talking about sort of safety in the summertime, and anybody can jump in, but what are some like non-COVID things, and also being careful around certain members of the police force and, trauma. We've talked about mental health. We've talked about trauma-informed care, trauma-informed education. We've talked about COVID, but what other, from the standpoint of safety, should parents and adults and kids and families consider?
Thank you. So I would say that, again, if your child is old enough to be vaccinated, go ahead and get them vaccinated as early as possible. I've talked to many families that say, oh yeah, we'll get it at the end of the summer. We'll get it, right before school starts, because, if their school is requiring it, or if their child's going to college, they say, okay, we'll get it then. But really, you want them to get it early, because it takes almost a full 6 weeks, depending on, with the Pfizer vaccine, it's going to take about 5 weeks for them to be fully vaccinated, because you're fully vaccinated 2 weeks after the second dose. So it's not something you want to start the day before school starts because then they're going to spend that first 5 weeks unvaccinated. So otra vez, la cosa que es lo más importante, si tienen niños que tienen más de 12 años, por favor, ellos necesitan la vacuna, especialmente si están yendo a la universidad, como Kayla, o si está en una situación en que la vacuna está mandatorio. No espera hasta que el día antes te va a salir a la escuela o antes que la fin del verano, porque recuerda, necesitas 5 semanas. 5 semanas, no está vacunado completamente hasta 2 semanas después del último vacuna. So necesita las 5 semanas para ser vacunado completamente. So 5 weeks. The other thing is for parents, outdoor activities are okay, because the other thing people say is, obviously our kids have been in the house this whole time. We're all going crazy just because we're cooped up in the house type situation. So if there's, outdoor summer camps, outdoor, play dates with friends, in general, the data is telling us that the risk of transmission is pretty low. It's not zero. We can't say it's zero ever, but to be outside, get those kids outside, get them running back and forth, playing soccer, playing, dancing outside, running, whatever your kids like to do to blow off some of that steam. That's really important. So si sus niños pueden tener actividades que están afuera, son más seguros. No podemos decir completamente seguro. Pero es lo más que podemos decir. So, si ellos pueden ir afuera con los amigos, con de camp, con de fútbol o cualquier quiere, eso es importante para de salud físico y salud mental de los niños y de los padres también, porque los padres necesitan el tiempo. So enjoy the summer, but again, get that vaccine if you can. And, we in DC have made it readily available. You could log off right now and find a place that's still open probably. And, go get that vaccine for your 12 years old and up, because it's really, really, really important to get that protection on board as soon as possible. Otra vez, finalmente, la vacuna es muy, muy, muy importante para los niños que tienen más de 12 años. Son gratis y disponible en todo áreas de la ciudad.
And don't forget to wear your helmets.
Right.
And don't forget that if you're going to do any diving, feet first into any lake or pond. Now I know 2 young men that dove into and are now quadriplegic. So the 2 things or 3 things: wear your seatbelt, put on your helmet, even when you're doing the scooters, because you can still injure yourself, and then feet first when you're jumping into a body of water.
And get vaccinated.
And get vaccinated. I know, Kayla, you've got the last word.
Oh yeah, okay, well, I guess my last question is for anybody that wants to answer, but what does getting back to normal look like for you? ¿Qué le parece volver a la normalidad?
Well, I'll take it real quick and hopefully others can chime in, but I hope that we never get back to normal, right? I hope that we transform. I hope that we evolve higher, that we really create more inclusive spaces, more emotionally intelligent spaces, embrace diversity on all the levels that it exists in greater speed, because we've learned hard lessons during COVID.
Wow, okay. Yes, ojalá que nosotros aceptemos la diversidad y también aceptemos los cambios, porque somos muy inteligentes debido a todo que estamos pasando en el año pasado y ahora, y es muy bien que aprendemos sobre esas cosas. Okay, I mean, that was our...
Dr. Lauer?
All I wanted to add was that it's okay for each of you and each of us to reflect on what we want to bring back. There might be things from before COVID that we want to leave back there, and whether it is about our habits or the things we bring into our day-to-day life. I know for myself, I was just too busy, and the slowing down really helped me to think about where do I find my joy and my calm and my mental health. So I would encourage folks to just take an hour and think about that, and think about what you want to bring into your life again.
I would say to use your primary care doctor as your advocate if you have questions about vaccine, or if you're feeling overwhelmed, or you're feeling anxious, or whatever feelings come up. You know, as a primary care doctor, as a family doctor, I appreciate when my patients come and ask me a question and say, I'm not sure about this, why about this, what's this, but are open to hearing and to learning more. So use your primary care doctor, or if you don't have one, you know, connect with one to make sure you have that trusted advocate to help you navigate your way back to the new normal.
So I'm afraid we're out of time. We could obviously continue for a very long time. I'd like to thank each of our guests for a wonderful, robust discussion. We want to have you back real soon. Ms. Kayla, as always, thank you so much for being our interpreter. And I hope that everybody gets vaccinated. You stay safe. Don't forget your sunscreen. Everybody, no matter how much melanin you have in your skin, it's important to protect yourself. Feet first when you dive, helmets, seatbelts, and vaccines. Thank you, everybody. Take care.